Why do some foods cause bladder inflammation? Imagine enjoying your favorite meal and suddenly feeling a burning sensation or urgency to go to the bathroom. That's often because certain foods can irritate the bladder. Some foods contain compounds that directly affect the bladder lining or the muscles that control urination, leading to inflammation and discomfort. This is especially common for people with bladder conditions like interstitial cystitis or bladder pain syndrome, but anyone can experience these effects. One main reason some foods cause bladder inflammation is that they irritate the bladder's protective lining, called the urothelium. Foods like citrus fruits and tomatoes are acidic and contain citric or ascorbic acid, which can damage or weaken this lining. When the urothelium is compromised, irritants in urine can penetrate deeper into the bladder wall, causing inflammation and pain. This can make the bladder more sensitive and increase symptoms like urgency and frequency. Spicy foods are another culprit. They activate nerve endings in the bladder through channels called transient receptor potential channels. This nerve activation triggers irritation and neurogenic inflammation, which can intensify pain and discomfort. For people with sensitive bladders, spicy foods can be a real trigger. Caffeine and artificial sweeteners like aspartame or saccharin can also stimulate the bladder. They interact with receptors in the bladder lining that increase detrusor muscle contractions, leading to overactive bladder symptoms. Caffeine, in particular, can also influence nerve pathways involved in pain perception, making symptoms worse. Some foods high in histamine, such as eggplant, can activate mast cells in the bladder. Mast cells releases inflammatory substances that contribute to irritation and pain. For individuals with sensitivities, eating these foods can lead to flare-ups of bladder symptoms. It's also important to recognize that individual sensitivities vary. Some theories suggest that irritation in the gastrointestinal tract from certain foods might send signals through nerves that communicate with the bladder, causing discomfort or inflammation. This neural crosstalk can explain why some people react strongly to specific foods while others do not. To support bladder health and possibly reduce the risk of bladder issues, it's wise to limit or avoid common irritants. This includes acidic foods like citrus and tomatoes, caffeine and alcohol, artificial sweeteners, and spicy foods. Eating a diet that supports the bladder's natural barrier and reduces inflammation can help maintain overall bladder health. Since everyone's body reacts differently, it's helpful to pay attention to your own triggers. Keeping a food diary and consulting with healthcare professionals can guide you toward a personalized diet that minimizes bladder irritation. Remember, managing your diet is a key part of supporting bladder health and reducing symptoms related to inflammation. In summary, foods cause bladder inflammation mainly by irritating the bladder lining, activating pain pathways, and promoting inflammatory responses. Being mindful of what you eat and making informed choices can help keep your bladder comfortable and healthy. Always talk to your healthcare provider for tailored advice and support.